Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxie, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I am speaking with Ariel Efergan, who is the CEO and co-founder of Pangea Medical. Welcome to the show.
Thank you for having me.
Yes, it's good to have you here. So let's start off by telling our viewers and listeners a little bit about your background and what you've been innovating.
Yeah, so I'm founder of Pangea Medical, which is a healthcare organization that aims to work with payers and providers to better understand patients in an effort to deliver the most accurate and cost-effective care. We really took kind of a different approach at this by focusing more on social determinants of health, which is something that I'm pretty passionate about. I started Pangea Medical kind of out of school at University of Maryland, but then really got formalized at a booth at University of Chicago. We were in a program there. We've been around for about 3 years. I don't know what much else I can say. I mean, I'm very passionate about healthcare. My family's in healthcare. I had a lot of unfortunate encounters with healthcare throughout my life. So it's been a very prevalent component of my life.
Yeah. So where are you in the innovation process now?
So I would say we're kind of maybe on the cusp of scaling or growth. We're really kind of have proved out our care delivery model, which is really the core of our innovation, is how we care for our patients. And then also the business model we created around that. And so we've validated that over the last 3 years, iterated on that consistently, and obviously consistently are iterating on it. And now we're just about to start raising our first, or we're in the process of raising our first round of financing. Obviously, this whole Corona situation has put a bit of a detour on that, but ultimately, we were prior to Corona, we're at the point where we're about to start scaling.
Yep. So Ariel, let's talk about some of the earlier days before we move into now. So kind of take us through the journey and the last 3 years. What are some of the biggest challenges that you faced and how you overcame them?
Yeah, so I would say early on, not having a background in healthcare and just not knowing, which is also part of the fun, right, is just, ignorance is bliss to a certain extent, but healthcare is a very complex industry, as you know.
Yep.
And so just being able to understand all the nuances that go along with particularly selling in healthcare took me a while to grasp. And there's really no good way to fully understand it aside from just going out and doing it. So that was one of the big challenges. I think second to that was understanding really the impact of technology in healthcare and setting realistic expectations for how I think technology will play a meaningful role in improving patient outcomes. There's different facets of healthcare you can look to improve: efficiency, cost reduction, quality metrics, etc. For me, the primary outcome is patient outcomes, right, and quality metrics, and also costs. And then I would say the third kind of biggest challenge early on was not fully comprehending how important it is to have, for lack of a better term, big names behind you, right? And that kind of clinical validation, and also going through the process of both clinical and kind of peer validation, right? So trying to get published in academic journals, as well as bringing in really recognized figures within the healthcare landscape to kind of back your idea and back what you're doing. Because it really is tough to be taken seriously, I guess, by these behemoth institutions that have a very particular way of doing things, been doing it for a while, generated billions of dollars doing it this way. So they're very risk averse and very, I guess they don't want to change their ways.
So what were some of the strategies that you deployed to kind of get through that validation or proof of concept process? Because it can be expensive and it can take a long time. And sometimes it's not just the technology solution that you have that's going to make the difference on whether you're going to be able to even get through that phase of the innovation process.
Yeah. So first and foremost, what I tell people is customer discovery is the most important thing ever. I can't tell you how many times I'll speak to people and they've spent God knows how much money on something that they never asked anyone if they wanted. And then they tell me this idea. I'm like, listen, one, it already exists and it's done really well, or two, there's just no need for this. Yeah. Right. And then they go out and they start trying to pitch it to people and they're not selling. And they're like, oh, why is no one buying this? Trying to understand what they want. So when I started Pangea, it was originally a different idea, but I spent a significant amount of time literally just interviewing people who were industry experts, who would be my end user, who would be our buyers, and just literally interviewed hundreds of people, asking them, would you buy this? What do you think about this? What would you want to see in something like this, in a program like this? So that's first and foremost, is customer interview. I can't explain how important it is, and not with people who you're comfortable with, right? Your friends, your family, they'll be supportive, right? Yeah. You need to have the guts to go out in the street and just walk up to random people who you think are your target demographic, say, hey, do you have 5 minutes? I'm doing some research for something.
Yeah. Why do you think so many innovators are, or just entrepreneurs in general, are just opposed to that part of the process?
I think primarily because part of being an entrepreneur or innovator is you have to have a really strong conviction in what you're doing. Sometimes that can be clouded with arrogance. Sometimes that could be clouded with other things. But ultimately, if you really, really, really strongly believe that this is the thing, I'm going to push this, whatever, there's in your mind, there's no doubt, oh yeah, 100% everyone else is going to want this. Why would I be wrong? Like, I believe in this so strongly. Right.
Yep. Mm-hmm. I can see that.
And then maybe another reason could be it's uncomfortable to do, and people are afraid of rejection, right? And so being told no, or your idea is stupid or whatever is pretty disheartening.
Yeah.
I've heard, a lot of that.
Mm-hmm.
And so I think that's the toughest job of an entrepreneur, is to know what no's are legitimate and how to take that feedback and internalize that and use that, versus people who don't actually really know so much about what they're talking about, and you think you know better than them, because to a certain degree in some situations you do, but having that humility to know when you don't is possibly one of the most important things.
Yeah. And it's so true. It is such a fine line, because that persistence, and like you said, conviction is a huge driver in entrepreneurship. And so there's almost a certain amount of, I have to ignore what people say, because I'm fighting against a status quo and I'm trying to change behavior and change beliefs, right? I'm acting as this change agent. And then there's also this piece that is like, but I can't just ignore everything. I can't ignore my customers. Otherwise I might find myself in trouble.
Yeah, I 100% agree. It's definitely a tough, you're kind of sitting on the fence. And so it's tough to make those distinctions, but it's just so important.
So how has COVID impacted your business?
Pretty significantly, as with most people. Mm-hmm. So first and foremost, the buying environment in healthcare has changed significantly. Provider groups don't have a good capital flow right now, and so they are not able to invest in innovation, which they didn't want to do before, and now they sure as hell don't want to do. And so all of the conversations we were having essentially got pushed back significantly. On the payer side, they're flushed with cash right now, but they're pretty apprehensive to doing new things in that no one really knows what healthcare is going to look like after this. Already we've seen significant changes in payment models in healthcare, particularly around telemedicine, where, this was such a big ordeal for years and years, and literally just like that, they removed all the regulations around telemedicine, and now you can bill for like a regular visit and everything. And so that's a pretty big indicator, I think, that other payment models in healthcare will change significantly. So everyone's just a little bit scared right now. So no one's really moving forward with things. I mean, I talked to my other friends and CEOs of other healthcare companies that are much larger than we are, and they sell to the same organizations, and they tell me the same thing. I mean, I know a pretty big organization that's kind of on the cusp of collapsing almost because of this.
Yeah.
So I would say that buying behavior has changed significantly. And then also how people expect to engage with healthcare. I think it'll be really interesting after this to see, are people scared to go to hospitals still? What does that do to utilization rates? How do people actually feel about telemedicine, right? What kind of impact does that actually have on someone's well-being and care? So yeah, there's definitely a lot of open-ended questions that has made the buying environment more conservative.
Hey, it's Dr. Roxie here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So I think that, the market has changed for everyone in some form or fashion. In some ways it's open doors, in some ways it's closed doors. One of the common themes that we've been talking about a lot on the show has been pivoting. And I think each innovator or entrepreneur kind of has their own pivot path or pivot journey. So how are you pivoting now? What are some of the considerations that you are evaluating?
Yeah, so I would say first and foremost, like most people, we tried to put out a COVID-specific program. That was just a very, even though the value prop I think is very strong and other people agree is very strong, it's just very hard to get in front of these people right now. No one has time. Even people I have strong relationships with that are CFOs, CEOs of health systems and insurers, right? They just don't have time to meet with me.
Yeah.
They know what we're doing is innovative. They know it's something new. And frankly, they just need to stick to the basics right now. For us, we were thinking about one of the big components here is testing, right? For manufacturers, for frontline employees outside of the healthcare environment, how can we get those essential workers up and running? And so trying to put out a program around that is something that we're evaluating. Actually helping to distribute testing is something we're evaluating, which doesn't really have anything to do with our business model, but you got to do what you got to do. Mm-hmm. And then there's other conversation that we're having that, should we put the company on pause right now? How could we go about doing that? Is that something that we want to be considering? Because in the funding environment, right, you fundraise essentially based on expected benchmarks that you think you're going to hit. This has completely thrown off all those projections.
Yeah.
And so you really need to think logically and conscientiously about what realistically can we do in this environment, expecting that there'll be a bounce back in the winter, expecting that there won't be a significant solution until early 2021. Those are the kind of things that I'm thinking about.
Mm-hmm. Yep. And I think that that's a realization that many entrepreneurs are facing right now is kind of, I say like that first pivot question around finances is, do I have enough runway to carry on? And does it make sense? Am I even still relevant right now? If I'm not going to be relevant for the next 6 months, then how do I need to, pivot the business to either close down appropriately with grace, or, right? And then spend that time rethinking what's next, right? Because, once you get the bug, it's really kind of hard to let go of this whole crazy journey, right?
That's for sure.
Yeah. And so I think that, that's really important, and it's going to be different for everyone. And I don't think that there's any shame at all with coming to that realization that my business, my market, my customers' needs have changed. Yeah. And if I pivot, I may be changing the entire DNA of my company. And so I really have a different company. I don't just have a pivot.
Right. Yeah. And I think, as we kind of talked about a little bit earlier, right, some of the greatest innovations in the world have come out of pivoting, right? And what the founders originally set out to do has absolutely nothing to do with their business that blew up. And being able to be creative and flexible are key characteristics of a successful entrepreneur. And there's nothing that amplifies that more than being in a international pandemic,
right,
economic crisis.
Yeah, absolutely. There's story after story of companies that were one step away from collapse that then found their Eureka moment, and I think that we will find many of those stories come out of this.
Yeah, without question. I mean, the greatest periods of innovation throughout history have always followed some type of catastrophe.
Yeah.
Right? There's a reason for that. And it's about who, has the guts essentially to continue in this type of environment and who doesn't. And there's different ways about going to do that. But it doesn't necessarily mean going ahead with your existing company, but even if you have to close out, right, starting something else or picking yourself up and doing that next thing is really how great companies and great entrepreneurs are made.
Yeah, absolutely. So, one of the characteristics or attributes of an entrepreneur in order to really be successful is resilience. And so this crisis is, I think, testing all of our resilience in ways that we're in the fire and ways that we maybe have never been before. And so how are you staying motivated? What are some things that you're doing to kind of stay optimistic, hopeful, and encouraged?
Yeah, I think one of the big things has been just the actual journey of this until this point of just hearing so many no's and so many rejections and just getting comfortable with that, which you have to.
Yeah.
And by the way, all entrepreneurs say that, and it doesn't mean that it doesn't still suck when people...
Right, exactly.
Right?
Note to everyone listening, it still sucks.
Yeah.
Even at 100 no.
Right. Everyone's like, it's an easy thing. Oh yeah, you hear no's. I heard a million no's. I went to pitch 50 VCs. They all told me no. And this one gave me my break. Right? Those 50 ones, they suck for that person.
Yeah.
And they still suck.
Right.
But going through that and being a pretty stubborn person, right, which my mom would gladly speak about on end.
Yeah.
I think that this is just another no for me. And I know that if you push past it, right, eventually there's something good that comes through. And I mean, probably one of the hardest things to discern from all of this is that sometimes the no's are right. You really have to listen to your gut and take a step back and look at your situation, listen to your advisors, listen to the people around you. And really the no sometimes might be right, but that's the fine line you need to balance.
Yeah. So speaking of those advisors and mentors, who are 3 people that have been most influential for you in this time?
Yeah, so I've been very fortunate to have really amazing advisors, both personally and also for the company. spent a lot of time getting those people, right?
Yeah.
Networking, a lot of persistence with the no also comes to persistence.
Right.
Meetings and advisors. I would say so. One person who's very influential is one of our advisors, Deborah Geisler. She's the CEO and founder of Activate Healthcare. Is a pretty well-known figure in the healthcare world and startup world. She, is very good at understanding these types of situations and kind of pushing away all the fluff and getting to the core of the problem or the core of the solution, what's actually valuable there. And so helping me think through that a little bit has been very helpful. I don't know, I have a lot of different advisors. I had, one of our very close advisors, a guy named Joe Beatty, who he took a couple of his own startups public. And he's, I think, a clinical professor at Booth, the University of Chicago, and is an investor and whatnot. And he actually didn't do anything really in healthcare, but just kind of being able to talk to those types of people outside of the healthcare environment.
Definitely.
To understand, how they dealt with these types of situations, how they make those types of decisions and think on these types of problems is very, very helpful. And also they're just great people.
Yeah.
And I think you've cultivated a relationship where they genuinely care about, my personal success and the success of this organization and what we're doing. And so being able to get that honest feedback and being open to that is very helpful, and not just kind of shutting down people's ideas when they give you negative feedback.
Yeah. I mean, I think that those kinds of, I call them thinking partners, are just really critical to this journey. Oh,
yeah, without question. I mean, I probably have, 12 to 15 advisors that I talk to pretty regularly.
Yeah.
Which is crucial.
Yeah. Yep. Absolutely. So I'm going to ask you this question. I think it's a very interesting question. So if you had extra budget money to spend, what would you spend it on and why?
That's a good question. I would say probably hiring more people. So I think it's hard to get FaceTime with people during crises, but it's also actually easier to get in touch with higher level people because everyone's just freaking out and looking for a good solution. And so they're very open to different things.
Yeah.
If that makes sense. So I would say, hiring salespeople, honestly, would be what I would spend it on.
Yep. Okay. Yeah, I think it's an interesting question. It's just kind of a fun game to dream build on what we do, because, eventually it will come.
Yeah, I completely agree.
Yep. So, you've been at this for 3 years. As we wrap up here, no matter how long, even if you've been doing it for 3 months, I feel like there's still lessons to be learned. So 3 years in, what are some lessons that you've learned so far, or some guidance that you would give to our listeners?
Let's see. I would say in no particular order, maybe the top 3 things is, one, just consistently seek feedback from people and be very open to feedback and criticism. 2, it's a lot of people say it's all about who you know, right? Which is a very important rule of thumb, I would say, in general in life, particularly being an entrepreneur. It really is all about who you know, but it's about the value you bring to those relationships even more so. Right. And so being able to deliver strong value to those relationships is very important. Just kind of network. It will never hurt to do that. And that's something I personally put a lot of time into, and it's helped me so much. And keeping in touch with those people and, sharing interesting thoughts and, doing favors for them. Relationships are the most valuable currency. And then 3rd, I would say that this is super hard and it's a lot harder than you could have ever have anticipated.
Yeah.
There's serious psychological and mental impacts. And it's very hard to relate to people when doing something like this. And so just to understand that you're not the only person who's gone through something like this, and that it's very difficult for you, but it's also difficult for everyone else who's doing it. And that it's really important to understand the stories of successful entrepreneurs, but to not only listen to those stories, because that's very few and far between. And so just knowing that there's millions and millions of people that have tried things that have failed. And from what I can tell from talking to many people and investors, that the most successful entrepreneurs are those who have failed, but have had the persistence to get up and continue to go. So even though it's hard, even though you might fail sometimes, just never stopping is the number one rule, I would say.
So that's why I do the show, right? Because here we talk about the good, the bad, and the ugly. No one comes on and tells the rainbow and butterflies story of healthcare entrepreneurship. We talk about, when we get knocked down and how we struggle to stand back up. And the intention is for those stories where you see and hear your peers in the trenches, that it becomes very encouraging, inspiring, and you grab a hold of some piece of wisdom that you can take on in your own journey. Yeah.
Yeah, I think that's an amazing thing to do, because, everyone and their mother has a podcast or show about successful entrepreneurs and whatever, and very seldom do we actually hear about the tough times and the real nitty gritty. But yeah, it's amazing.
Yeah, exactly. So Ariel, how can folks get a hold of you if they want to follow up with you after the show? Yes,
you can email us or just find us on our website at info@pangeamedicalcare.com. You can follow us on LinkedIn, look up Pangea Medical. There's another Pangea Medical that I think was like a fraud primary care clinic in Arizona, because I keep getting calls, or our office keeps getting calls about people wanting to collect money from this primary care office that was called Pangea Medical in somewhere in Arizona, I think. So that's not the right one. We're PangeaMedicalCare.com. So definitely, reach out. If you address an email to me, I'll definitely respond to it. Again, info@PangeaMedicalCare.com.
Awesome. Thank you so much for joining me today.
Yeah, thank you very much. This is great.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app, like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.